Hello everyone, I am Dr. Madhurika Kate. I am a neurophysiotherapist by profession. I have completed my MPT Neurosciences from Manipal Academy of Higher Education in the year 2020, and presently I am working as an assistant professor at Dhole Patil College of Physiotherapy. Now, as a part of a breastfeeding week that is celebrated in the first week of August, our Honorable Chairman, Shri Sagar Dhole Patil Sir and Srimati Uma Dhole Patil Ma'am had taken an initiative to spread its awareness at every stage and reach possible. So, I would like to share a few facts regarding the same. Now, what is breastfeeding? Why it is celebrated? So, we know that breastfeeding has been practiced since the ancient times. Newly developed mothers feed their children. Now we know breastfeeding plays an extremely crucial role for the healthy growth and development of an infant. This has been known to us, told to us by all our mothers, grandmothers, grandparents every time, and that breastfeeding is important. So for the same additionally, it is an overwhelming experience for the mother. Mothers go through a lot of different phases at that point of time. So hence World Breastfeeding Week is observed every year to emphasize regular breastfeeding for the babies. So it has been mentioned that breastfeeding commences from 1st of August while it concludes on the 7th of August. So purpose, why it has been celebrated, why this World Breastfeeding Week was developed, and why it is being celebrated. So UNICEF, UNICEF is United Nations International Emergency Fund. That is also an allowance for who takes care of the nutrition and proper growth of the children, especially in countries which is developing country and underprivileged children. And WHO, World Health Organization, and WABA. WABA is World Alliance for Breastfeeding Action. All these three collaboratively targets mothers fed milk to their babies for incredible health benefits. That is, all the children should get the access to breastfed milk and their growth for the better growth. Now UNICEF, WHO and WABA emphasizes the first 1000 days of life, that is the initial stage of life, that is 270 days in utero, that is when the fetus in the womb, and 2 years after the birth as a critical window period for nutritional intervention. That is, this is the crucial period during which the child gets, you can give maximal nutrition to supply to the child. So this period is the one when brain maximally expands in the period, and any case of any lack of nutrition may lead to stunting, that is stopping of the growth, not optimal growth development, and even suboptimal development, that is not as per the normal standards of development. So this was developed to encourage mothers for healthy growth and development of their child. So what is its significance? World Breastfeeding Week, that is WBW, is celebrated to highlight the importance of breastfeeding and its crucial role it plays in the life of newborn babies and new mothers. So it only doesn't target the babies, but as well as the mothers who are feeding their children. What are the health benefits emphasizing or targeting both of them or both of their growth? While we know breastfeeding can prevent babies from infections, and it also it lowers the risk of later health issues which a child may develop or prone to develop at a later stage of life. So it is said that breastfeeding helps in lowering the risk of breast cancers and ovarian cancers in new mothers. So research says that newly developed mothers, if they go for naturally breastfeeding their children, it lowers the risk of developing any kind of cyst in the breast or tumors or any kind of cancers, or even in case of ovarian cancers. So beneficial effects of breastfeeding depend on its nutrition, duration and age at which it is weaned. So initiation, so WHO suggests that the child should be breastfed as soon as the child is delivered after the birth, like within an hour of delivery, the child should be breastfed. Along with that, duration. Now WHO advises exclusive breastfeeding for first 6 months of life. The child must be only given breastfed milk of her mother or his or her mother for first 6 months. Along with that, you can give other kind of semi-solids and other kind of food, but first 6 months should be exclusively breastfed, and we can continue the breastfeeding for next 2 years after the birth. So it is very important when you initiate the breastfeeding for how long it is given and what it is being combined with other kind of supplements. Now going to the history, it was said that in order to encourage and support breastfeeding, World Health Organization UNICEF created a memorandum in 1990. So following this, World Alliance for Breastfeeding Action came into picture, that is, which was established in 1991, and the inaugural, that is the first breastfeeding week, was observed in 1992 to promote its campaign. Since then, every year various campaigns, camps are conducted for its awareness, and we reach up to the smallest stage possible, so that every mother gets to know the significance of that. Now discussing few benefits of breastfeeding to the mother as well as the child. Now for a mother, mothers who are breastfeeding burn extra calories after providing milk to their children when it is naturally provided breastfed to the child, which is very much important, and they can resume back to the pre-pregnancy weight quicker. So as a lifestyle change, all the mothers are very much concerned about their physique, their fitness. So if we are encouraging mothers to go for breastfed milk to be delivered to their child, it can also enhance their own health and fitness, and which will help them to come back to the pre-pregnancy weight as well. Now as we know that women who breastfeed have lower rates of developing breast and ovarian cancers. Now a lot of mothers who rely on other objectives or other things apart from breastfed milk have a chances of developing breast cancer or ovarian cancer in the later part of life, which may not be observed at an initial point of time. Now it also reduces the risk of postpartum depression and creates a unique bonding experience for a mother and a baby. We know a newly delivered mother goes through a lot of physical, emotional, social stress during that period. So breastfeeding gives them a relief or stress relaxation through which they are coming out of their postpartum depression, and it also creates a strong bond between a mother and a child. Now for babies, it has been observed that breastfed milk is rich in nutrients and perfect natural food for babies. Breastfed babies are also less likely to become obese in the later part of life. Then we all know at a very early stage, babies or children are vulnerable to develop a lot of infections. So the breastfed milk provide antibodies which fights off these viruses and bacteria while protecting them from various infections. So even that crucial period is important where we can prevent these kind of conditions. Now apart from that particular period, children who are breastfed as babies have lower risk of developing ear infection, respiratory infection, allergies and diabetes. So it has been also observed not only during that period, but the children in the later part of life have also less complication when it comes to these kind of infections. So it has been observed that since many years there has been shift in the culture where mothers are relying more on the artificial supplements rather than providing breastfed milk. Maybe a lifestyle change because of having a notion that breastfeeding might affect their physique, their beauty or all those things. But why this culture shift is there? What are the factors responsible for it? Now there is excessive marketing support and reliance on infant formulas. That has created a new culture and standard for infant feeding practices. So more mothers are relying on such formulas which do not provide the antibodies, the nutrients appropriate for the growth and development of a child. Now lack of knowledge among mothers about the importance of lactation. What are the benefits of lactation at that particular period of time should be known to the mothers. It is more of usage of supplemental foods. Mother rely more on supplemental foods to be provided rather than going for natural foods, that is our breastfed milk. Now poor coverage of breastfeeding advice given during the antenatal visits of a mother. Generally when a mother is childbearing, during that period it is very important that a mother should be more aware regarding the benefits of breastfed milk to the child's growth. Now this shift has been observed globally, and it says that research says that the countries which are developed, this kind of shift has been more observed when it comes to developed countries such as USA, South African countries. When it comes to Asian countries, still mothers are relying on the breastfed milk rather than when it comes to artificial supplements. But since the amendment or the start of inauguration of breastfeeding week celebrated, more and more changes have been observed. The research studies have concluded that more and more percentage of mothers are relying now on breastfeeding rather than going for artificial foods. Earlier it was known that less than 40% of mothers go for breastfeeding milk in developed countries. But as the breastfeeding week awareness has been started in the year 1991, more and more amount of breastfeeding practices have been observed, especially in developed countries. Yes, developing countries still continuing, but the right nutrition for the mothers has to be also taken care of while breastfeeding to the children. Now, specifically for this year, that is for 2022, breastfeeding week theme was designed on step up for the breastfeeding, that is educate and support. All the organization institutes who have childbearing mothers who are in the initial stages of their breastfeeding should provide a comfortable environment for their breastfeeding. That is, they should provide them area where they can comfortably breastfeed their children, or given some kind of period during which they can go and give breastfeeding to the children, so that they feel comfortable and breastfeeding can be practiced normally. Because of lifestyle changes and stress in the institutes, it is very much seen that mothers are not relying on breastfeeding and go for artificial milk supplements and all those things. So that is very much important for children to get a breastfed milk at the right point of time. So the objectives of World Breastfeeding Week for the 2022 were inform, anchor, engage and galvanize. So inform. We must inform every other individual around us. People around should know their role and strengthen the warm chain of support for breastfeeding. All those we are working with should be aware of the importance of breastfeeding, its significance, and anchor. Anchor means there should be strong support. We should support mothers or ladies to go for breastfeeding rather than relying on the artificial supplements. Now engage entire organization, individuals along with the warm chain of support for breastfeeding. We must engage everyone in these practices. Galvanize, it must reach up to every stage possible. Action and strengthening the capacity of actors and systems for transformational changes. So this is with it. I hope I shared few facts regarding the breastfeeding, why it is celebrated, what is its theme, why we do that for the individuals and the mothers. So I hope everyone liked it. Thank you.